Hi guys, I'm Sam from AspireMRCOG. I've been asked several times about how long does it take to prepare the OSCE for MRCOG. Now, having passed my OSCE recently in November 2021 with a remarkable score of 85%, and being in UK for the last 19 years, I think I'm in a reasonable position to, give you my views on this. And if you find them helpful, that would be good. If there is anything that you think you need to further ask or anything, you just drop me a line, please. As you can see that this is not a very straightforward question, or there isn't any straightforward answer to this, because everyone has got different circumstances, different levels of training, different seniority levels, different sort of preparation. So let's see how we can, approach the answer to this question. So first of all, I'll say that for one big thing, and I'll try to cut it short, okay? I don't want to go on and on about this. I'll say that there are four various categories in which I want to divide, the factors that will affect. First is that how well versed you are with the UK system. If you are well versed through experience or through learning from different mentors, that will help, okay? So that will greatly help. So, all the guidelines, all the practices, wherever you get hold of the information regarding how the things are done in UK, what's the culture in the hospitals, how do we communicate with our colleagues, how do we communicate with our patients, like how the referrals are done, how the various, who deals with what are the conditions where the GP alone will be dealing with them, when will they refer, how long does it take, and all those kind of things. So if you're well versed with the UK system, then your preparation time will be a bit better, a bit shorter. Okay. Second important thing is that when did you pass your Part 2 exam? So if it's fresh, that's good, because you have all the theoretical knowledge of the guidelines in, that you would have recently done, all the green top guidelines and the relevant NICE guidelines and the BASH guidelines and the FSRH guidelines and all those. So although the RCOG says that this exam, OSCE exam, is not actually a exam of the theory of your theoretical knowledge, but still, to proceed with this exam, the guidelines do serve as a backbone of your preparation. Okay, so how fresh it is. If you've freshly passed, then of course you will need very little time to revise all those guidelines, because you don't need to know the nitty-gritty of the guidelines. You just need to know the kind of executive summaries, the bold text, basically. Okay, third thing is that of course we covered this as a part of how fresh your Part 2 pass is, and that was actually one and the same thing. You can say that how well versed are you with your guidelines. For instance, if you did your Part 2 a year ago or 2 years ago, but you still kept yourself abreast with the guidelines, then of course this adds this is an advantage in your preparation. And the fourth thing is that how are your linguistic and communication skills? Because if, how good is your English, how fluently you can speak, how do you, face any communication barriers? Is your English well understood by people when you talk to them? Have you ever communicated with people who, not people who speak English in, globally in their country, because their English sounds different from the English that English people speak, like in Britain. So have you ever been in touch, have you ever been speaking to those people? If they understand you with fluency, and if you understand them fluently, that's going to really help. Okay. So if not, then that's a barrier, and that will require you to prepare for, get used to that could require a really long time. So, I mean, if you were not at the verge of your exam, I could say that you should watch English dramas and, especially the medical kind of dramas preparation. Then you can say, I would say, if you are very well in all of these, then 4 months. Okay, recent passing exam, knowing the UK system, well versed with the guidelines, and your communication and your language is excellent, then I would say a good 4 month preparation, like you don't do anything else, just focus on your studies, maybe eat pizzas in that time, no cooking and no, no such kind of activities, somebody to have good terms with your family and your partner to look after your children if you have in this span, and then you can probably achieve this in 4 months time. Okay, this is my reasonable kind of estimate, not an idealistic, like I'm not saying you have ideal circumstances. And I mean, some people might be extraordinary superstars and they may do it even quicker than this, and some I'm just saying on average it should take 4 months. Okay, and so you should start your preparation before you get the date of exam, because exam date you book like almost 2 months in advance. That time alone should not be considered as enough. Okay, so there will be a lot of risk if you did that way. And of course, if some of these factors are not very good, then I say, as I've mentioned here, that it can go to as long as 7 months, but please be ready, it can go up to 1 year as well. Some people appear in the exam that don't pass. So it's not like I'm promising you that it can happen in 7 months. What I'm saying is that it's a reasonable estimate if you're very well prepared and all that. But some people, they can, you have seen so many people, they keep preparing, but they take more than a year to pass, not because they were studying and preparing all the year, because there's a gap between one attempt and then starting preparation of the next attempt. It's not unreasonable to go for an attempt if you're not even sure whether you are ready for it, because who knows, you may be able to achieve something, and their RCOG does allow you multiple attempts. So that does also give you experience of the exam as well. So it probably is not that dangerous. If you think that you want to go for an attempt with, before feeling totally confident about that, then absolutely fine. Honestly, go ahead with that. Okay. So if there is any other question, just drop me a line. I do have, I'll written my email address and the Telegram link in the description in this video, and I wish you very good luck. Okay, we do sometimes do stations in our Telegram group to just give you some insight on various kind of things, how they are going. So if I'd like to hear from you if you join the Telegram group as well. Okay, bye for now. Bye bye and good luck.